Right, so let's just talk about Ife Dang. I know a lot of you have seen the video as she talked about surrogacy, and so many people has really dragged her like generator. I mean, serious dragging. Now, I'm not going to be talking about Ife's point of view as that those who have money for surrogacy, but I just want to point out that there are quite a number of medical conditions that may require surrogacy to be an option. I'm creative nurse and I've been a nurse for 15 years, registered to license to practice in 3 different countries, and I've worked across specialties including fertility, maternal and child health, public health, palliative care, and I guess I know what I'm talking about when it comes to medical issues, when it comes to surrogacy. Now, let's flip it. There are 3 different things that could make surrogacy an option. Now, number one is the woman's health. Now, let's just talk a little bit about when the woman's health cannot or is not medically advisable to carry pregnancy. Now, this could stem from cardiac conditions, or it could even be from use of cancer medications. Now, quite a number of these situations may not require the woman to be able to conceive or actually bring a child to term. So what they do is just freeze the woman's eggs and then implant it to a surrogate mother, and then she probably has the child if she wants to. Now, the second option is the woman's age. Now, this is very, very important. Now, researches have shown that after 40, there's increased risk of a first-timer giving birth to children with abnormalities. Now, I am not saying that the research happens 100% of time, because we've seen a girl who's 20 years old, 25 years old, and still has a child with special needs. So that is not, but the researchers have shown that more women are prone to having children with special needs because of their age, looking at the fact that, the biological clock has ticked. Most of their eggs are not as vibrant as it used to be when they were younger, and that could also be a predisposing factor. So quite a number of them will have to keep their eggs, freeze them, screen those eggs, and then probably give it to a surrogate to help them carry to term. Now, the third thing that I need to talk about, which is extremely very, very important, is history of any congenital abnormalities or the presence of a special needs child in the family of either the man or the woman. Now, this one I cannot emphasize this enough. Now, if you know that there is possibility of having a child with special needs, you probably might need to just go through the screening of your eggs. Make sure that the egg that is being implanted either to the surrogate, it's an egg that is free from such abnormalities. We don't want to bring in a child that will suffer a lot of consequences because of our own selfishness. So I think these 3 factors, which includes the woman's health, the woman's age, and even the capability to be able to carry the pregnancy or the genetic condition in the family, could be reasons for surrogacy. But all in all, as a nurse, the most important thing is mother alive, baby or babies alive and healthy. We don't want to have children that will have to keep suffering or going through the pain of our own decision or indecision. I hope you understand what I mean. Now, for as many as people that are dragging Ife, look, it's important for us to know that we have control over our bodies. And if we want to do it because of some reasons that are known to us but unknown to others, then there should be no castigation. There should be no discrimination. That's what I think. What do you think about this issue? Let's talk about it. This I see you in my next post. Creative Nurse Peniel, signing out.